Hello, my name is Antonio Hendricks, and today I'm dealing with a medical issue patient. I'm going to start with BSI. From there, I'm going to assess the scene for safety. I'm going to check the number of patients. I have one female patient, looks to be in the early mid-20s. I'm not exactly sure of mechanism of injury. The patient is responsive. I'm going to come up, address the patient, light taps on the shoulder. Miss, are you okay? Are you okay?
Yes.
She is okay. Ma'am, can I provide assistance?
Yes.
Yes, okay. At this time, I'm going to also consider calling 911. I don't know mechanism of injury, so I'm considering C-spine. From there, I'm going to go into asking what is going on. What happened?
I have a hard time breathing.
Hard time breathing. So right now, the chief complaint is a hard time breathing. So now I'm going to go into ABCs. Now, what I need to do right now is open your airway. I'm going to open the airway by pressing down lightly on the chin. I'm checking to make sure that it's clear and open. I'm checking her breathing. I'm checking for equal breaths. Move your hands to your side. I'm compressing in on the ribs, checking for equalness and disformities as well. Breathing seems okay. They're equal. She's not gaspy or anything like that. From there, I'm going to go into circulation. I'm checking head to toe for bleeding, as well as behind the neck very gently. Checking arms for bleeding. Underneath the back, ensuring that my fingers touch to get good conformity. Leg. I'm checking the ankles for pulling. I'm also exposing the collar and upper chest for pulling and bleeding as well. I'm checking the other leg, as well as checking the socks, checking the arms. From here, I'm checking the pulse to see if how circulation is. I do find a radial pulse. At this point, since no other issues with ABCs, I don't need to reassess them. Since this is a medical issue, I'm going to go into sample OPQRST. For S, signs and symptoms, then I'm going to go into OPQRST, which is onset, whether it was sudden or happened over a period of time. P is pain or palliates. Is there anything that I do that increases or decreases pain? Q is the quality. Does it radiate? Is it centralized? What type of pain? So from there, severity. On a scale of 1 to 10, I'll also find out what, since she is conscious, what her most extreme pain she's ever felt, has ever been, and that'll give me a broad generalization. And then I'll ask her if she knows the exact time that this happened. From there, I'm going to go back into the sample. Ma'am, do you have any allergies, whether it's medical, do you have any prescription allergies, so drug allergies, food, plant, or animal? From there, I'm going to ask you if you're taking any medications, whether they're prescribed prescription medications or non-prescription medications, to include recreational drugs. From there, I'm going to ask if there's any past or pertinent medical issues that would cause this or be reason to believe that they originated the issue. I'm going to ask her last oral intake of any kind, whether it was fluid or food, or even in this case, recreational drugs or medications. I'm also going to ask her what events led up to this. Upon completion of the sample OPQRST, I'm then going to go into my head-to-toe assessment. From there, I'm checking the scalp again for bleeding, dots, disformities, open wounds, tenderness, sensation and sounds. So crepitus, any sort of weird little things. So I'm checking the back of the skull, being very gentle. Again, checking for blood. I'm checking the nose and the ears for CSF, cerebral spinal fluid, which will present itself in a off-white color. From there, I'm going to check the bones of the face, making sure that there's no crushing or anything like that. I'm going to reopen the airway to check and make sure that there's no shattered teeth or anything like that. From there, I'm going to expose the neck again. I'm checking for deviated trachea, vein distension, and excessive bruising or swelling. From there, I'm going to check the shoulder girdle by pressing in and pressing out gently, one at a time, and then at the same time. From there, I'm going to palpate the clavicle, one at a time, and then the other, checking again for dots. From there, I'm checking the sternum by using the knife of my hand, going down the center, all the way down to the start of the ribs. I'm checking for, again, dots, pain, swelling. I'm going to expose the abdomen. I'm checking for swelling, discoloration, and anything like that. From there, I'm having her take a deep breath in again. I'm checking the ribs. This will also let me know if there's flailed chest, which is 2 or more broken ribs on the same side, any other potential broken ribs or issues in the rib area. From there, I'm going to palpate the 4 quadrants. I'm checking for tenderness, I'm checking for bruising, swelling, discoloration. I'm then going to check the pelvis by pressing in, crossing my hands and pressing out. They'll also let me know if there's any issues there. I'm going to verbally ask if there's any problems with the groin. Yes, no, this will dictate further injuries. From there, I'm moving down the legs. I'm squishing hard enough or pressing hard enough to check for any bones, issues, again, dots. I want to know if anything is equal or unequal, if there's any natural deformities. I'm going to work my way all the way down one leg, checking everything. I progress around the other leg, again, checking the same thing. Being careful of the joints does not cause any more issues. I'm then going to check CSM by lightly scratching or pinching, and then I'm also going to check capillary refill. From there, if they're able to, I'm going to have them either lift up on the foot at the same time, both feet, and press down as well. From there, I'm going to go to one arm, checking everything gently. Again, same thing. You're checking both arms for deformities, swelling, irregularities. And since she is conscious, I'll be asking her if anything causes pain or discomfort. From there, I'll check again CSM on the hands. I'll say squeeze my fingers as hard as you can. This lets me know strength. Drag your fingers across the top or across the palm, as well as pinching for CSM. From there, I'm going to go back up to the neck, and I'm going to palpate the back of the spine from there, before I do the log roll. I'm checking for, again, dots with that as well. To perform the log roll, on the non-injured side, you'll place the hand above the head, bring the opposite leg up to the knee, maintaining the cervical brace. You are then going to rotate the person over on that side, gently and in uniformity. Once they're all the way over, you'll use the bent leg to support them. From there, you're going to come back around the back side. You'll expose all the way up. You're checking for dots again. You're going to palpate the spine on both sides and down the middle, ensuring that nothing is out of alignment or broken, swollen, etc. You're going to check the butt and hips again, as well as the back of the legs for bleeding and dots. If this position is comfortable, you will leave the person in this position. From there, since they are conscious, I'm going to go back into their vitals. I'm going to check ADFU, awareness, verbal, pain, or unconscious. So she is conscious, she at least has an AV. From there, I'm checking pulse. Pulse is rate, rhythm, and quality, whether it's thready, weak, strong, bounding. Checking breath. I'm seeing how many breaths per minute, which lets me know rate and rhythm. And again, I'll be checking quality for that as well. From there, I'm going to, since this isn't comfortable, or because I asked her and she says okay, I'm going to gently, again, maintaining seat, roll back onto the back. From there, I'm going to take down the sock. I'm going to check the distal or pedal pulse. This will let me know, since I've already got a radial pulse, it lets me know systolic blood pressure. If I get the pedal, whether it's across the top or on the inside, will let me know blood pressure as well, at least a systolic of 90. From there, I'm going to come up and check the eyes again, make sure that they're equal, round, reactive to light. I'm also going to check tracking. This will also let me know funky things that are going on in the head. From there, I'm going to check her skin color for tone and moisture. And then upon completion of all that, I'm going to reassess her vitals, potentially treat for shock, and maintain any potential issues that may have came up. Thank you. Have a great day.